You're listening to the Pace Radio Network here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Want to talk about news, don't want the drama. From no pretentious media Madonna. I found me a great ganja mama. Cannabis and coffee with Tamarijuana.
Good morning, everybody, and welcome to Cannabis and Coffee with me, Tamarijuana. Well, it's Monday, and it's going to be an interesting show because we are going to talk about substitution programs and what it entails to actually put the programs together and what teamwork it actually really is and what it'll entail. So we've advertised that we were going to have a different show, and that topic now has changed. So today we're talking cannabis substitution rather than fuck around and find out, because we've decided that we're not going to feed the trolls. So that's over. Done. Ends today. No more bullshit. And that's where I'm leaving it. So I'm going to welcome my guests, who are Dan, Adam, and Rosie. And we're waiting on Asia. But we are going to be here and talk about cannabis substitution and how it works. Good morning, folks. How you guys doing?
Wonderful. And yourself?
Good
morning, everybody.
So we're going to talk about what you guys have all been doing and why you guys are doing it. And first of all, we want to shout out to the start of it, because if it wasn't for Neil Magnuson, none of this would be going on. Now, unfortunately, we no longer have.
We have a reverberation or something.
There's an echo.
Yeah, I got no echo.
It may be because it probably could be a headset thing, but again, it doesn't matter. We'll figure it out along the way, because it's just with the room sizes, because I don't use a headset most of the time. But yeah, it could be that issue. But okay, I'm not gonna worry about it. This is like a casual conversation. Like, it's not like, as you can see, the professional studio I'm in. Al has actually, we do Pace Radio. He's got stuff behind him. I don't care. I'm here to talk about awareness for people not. All right. So again, Neil was somebody that most of us knew. I knew Neil for 18 years. I met him way back in 2000, and I believe it was 8, when he first did the Freedom Tour and he first came through Alberta. This is long before the substitution program ever started, right? And then over the years, he then progressively was fighting for freedom for everybody. And he did 3 tours or 4 tours where he actually roller skated across the country and got himself to Ottawa to talk to the politicians in Ottawa. So that's how I first met Neil. Now, the substitution program is something that I think was absolutely fabulous. We started, I believe, with Van Duke in downtown Vancouver. Now, right around the same time as when Dana got his first machine for the drug testing as well. So that all kind of went hand in hand too, because everybody was working kind of together back then. Now we all see how that's progressively changed with legalization, and people got into the legal industry, and then we've got us, right? And other people that are doing other things. So in that time too, fentanyl was introduced to Canada. And when I first started this in 2008, we were worried about cocaine and meth and heroin and those kind of hard substances. And then all of a sudden we had fentanyl. And then all of a sudden we had carfentanil. And we have all these substances. But to be clear, this is not a new problem in downtown East Side Vancouver. When I was a kid in the 70s, I was told that if I did drugs, I would end up on the east side of Vancouver. Social media has really put a spotlight on East Hastings and East Vancouver when the problem has been there for decades and decades. This is not a new thing, right? So, cannabis substitution, we all know works. me, I'm a living proof of that because I started, using cocaine when I was 17 years old. And I was 35 and finally decided that enough was enough. When I smoked cannabis for weeks straight, up to a quarter pound a week, to get off of the cocaine, right? And it worked. 19 years later, here I am. So, Rosie, we're going to start with you for a sec because you've been running CSP Surrey for how long now?
So I started December 17th, 2022, middle of winter time. And that was after having a conversation with Neil and talking to him about it first and seeing what his thoughts were. And he did say to me at the time, I remember him clearly saying that there was, maybe Adam can attest, I don't know, but there was a couple, I guess, that did it before in Surrey. There was two people that started it in Surrey. They did it for a very short time. I guess they got a lot of backlash. They said it was really extremely hard to do, and I guess maybe the RCMP had a factor to play in that. I don't know, because the RCMP was still here when I started. I think the difference though is that, like, I know I've only been around the cannabis community since 2020, 2021 maybe, but I've been a harm reduction activist for 15 years, and I was giving away edibles to overdose prevention sites before I even met Neil, and that's how I met Neil. Was because someone saw what I was doing in Surrey and said, "Hey, have you ever met Neil Magnuson on the downtown east side?" And I'm like, "No, I've heard about him. I never really met him." And so I went to meet him, right? And I never did anything without consulting with Neil first. I wasn't trying to overstep what he was doing. I really, what I said to him is like, what you're doing here is amazing, and we need to expand your vision to other cities and other places, and start to raise further awareness. And it basically was just like a way to become part of the family and start another division, right?
Right. Community, and that's, I think, where we all,
so yeah, like that's
all
how
our heads are at with cannabis, is we all want a community that we can all kind of stick together with, right? And just kind of like all work together. So Adam, I'm going to bring you back in, and you can talk about, because you worked with Neil downtown, right?
Yeah, I spent better part of the last 3 years with him.
Making noise for everybody.
I'm going to mute the mics, because if I mute your mic when you're not talking, it seems to shut down, Rosie.
Yeah, that makes sense.
Okay,
Yeah,
I've
spent the better part of the past 3 years with the man. And not only was he a great friend, but he definitely was a great mentor, both in the cannabis industry and just, as a human. Taught me a lot about compassion. And, it's, everybody talked about the fact that there was money being made there, but all of that money went right back into what we were doing. Whether it be that tiny little bit of profit at the end of the month, it went into the next event, or, you know what I mean? He lived well below his means. He lived upstairs in the shop, like that's dedication. When I first, like, I donated to him since, I guess, 2018. And then I think it was the beginning of 2022, he got raided. And so I seen it online, and I'm like, you know what? I got to go and bring him a big box of stuff in the morning, because I know that he's going to be outside doing his thing again. You weren't going to stop that guy. And so I brought him a big box of stuff, and he's like, hey, because usually I would just, bring him a big box of stuff, and then I would take off back to Surrey. But he asked me to stay that day. He's like, oh, come help us set up the tents and whatnot. And I never really left after that,
Yeah.
Yeah, and so I got to see the inner workings, and I was proud to say that I was kind of his right-hand man towards the end, and yeah, he taught me a lot.
Well, that's the thing with Neil. He was always a great educator, a great speaker, right? And he would, like I said, he'd stand up and sing "Oh Cannabis" at every event. I remember him singing that Saskatoon when we were at Harvest Fest the first time we went out to Saskatoon. So we're gonna bring Dan in now, and let's see what you have. Like, so when did you start, Dan, and what inspired you to start playing this?
I used to work for Street Saviors a long time ago and do a bunch of stuff on the streets in downtown Vancouver. I did that for a bunch of years. And then I have a company that just sells weed, and we used to go down to 420 stuff. Of course, I'd listen to Neil. He was really inspiring. Not just Neil. There's a lot of people up there who super inspiring. Neil is obviously a speaker. After doing it for a bunch of years, we started doing at those places. Neil would come in, sit down and talk with us. All these other, and they'd come down and chat with us. And I started to get more interested in the side of helping than the side of making money. Anyways, I just always felt like I could give back. So I started joining the CSP with Rosie once I met her. I didn't do that until I think it's been about almost 2 years, I guess. A year, like a year and 8 months or something. Anyways, and I started working with her, and our team came out, and they all loved what we were doing, and so they started working with her too. And then eventually we expanded to Langley. So now we've been doing that actually just the other day for a year. We've been doing Langley, and then we Adam and I got lucky and started having some good reasonable conversations with some of the people from the other side of this dilemma, and it led us to decide to go and talk to the mayor's office. And now I'm actually at the stage where, even though I'm committed and will continue to do CSP forever as far as I'm concerned, or until the problem's solved, but I've got a really strong interest now in and talking to the people on the other side and trying to get through to them as well.
Right.
We've got a team of people now. It's not me. I'm no genius, but I mean, we have a bunch of people. My dad used to tell me, surround yourself with smart people if you want to be smart. So we did that. We found a bunch of smart people. We've got our ducks in a row, and we're going to go back and talk.
Right.
There's been a lot of rhetoric. There's been a lot of, and everything, but we are focused. We know what we need to do. The government is waiting for us to respond, and we are doing just that. And it's going to get us to the next stage and the next stage and the next stage. And eventually, hopefully, there'll be no need for CSPs if it gets done correctly.
Right. Exactly. And I often have said this over the last little bit, because we've got such an opioid problem. If they would have rolled out safe supply the way they rolled out cannabis with manufacturing, putting it behind the storefront, making it 19, and that would have maybe made things not so hard with the safe supply, where people actually could use it recreational. We all know that a lot of people are dying because they use it recreational. It's not the addicts on the street that are always dying. It's people that go and grab a gram on the weekend and end up with fentanyl in their cocaine, and they end up dead with 4 kids, waking up with mommy and daddy dead on the couch, right?
If we're honest, I don't mean to interrupt.
So 80% of people who are overdosing are dying alone in their homes.
If we're honest with ourselves, system has been set up deliberately, like all of our healthcare system, to milk the most amount of money out of any situation. Yeah. This is the problem with our healthcare system. Cannabis is an issue, but it's like a point of the spear. The spear is long, and there are many problems with the way in which the government has decided to turn the people of Canada into customers in the healthcare system. This is another example of that. We have a medicine that is perfectly designed to fight this problem. And sure, maybe it won't work for everybody. Heck, maybe it only works for 40%. But if 40% of the people out there were out of the way and had a place to go and work on their issues, then we would have mental illness and the severely addicted left over. That's a lot less energy and money to pour into a problem if you've removed 40% of the problem. And all they have to do is change the law to say we can use the stuff that the large producers throw away. It's a real thing. It's small.
And what a waste, for all of that. What a waste of materials that could be going to all kinds of people. And let's face it, how many people, we don't get discounts as patients anymore, because they don't do that. I don't buy full license producer anymore. That feedback's bad. Hang on, I'm gonna mute. Maybe it's me the problem. Maybe I'm the problem. I'm the problem. But there's no staff, there's no discounts for patients. And I don't know how many patients are actually accessing through the mail anymore, right? And even when I was accessing through Broken Coast, when we first came out with this MMPR program that we got thrown into, there was no discounts. It was still $10 to $15 a gram all the way up. And when you get a 15 gram a day prescription, or a 20 gram a day prescription, let's face it, you cannot afford that. The affordability. So even when I went for my last one through at Namaste or whatever, 420, so it wasn't going to cost me anything because I wasn't able to grow anyway. They refused to up mine to 20 because they told me that they couldn't see me being able to afford it, which is none of their damn business. But that's what I got from the license, or from this whatever group that I had to get my licensing through, right? So people need to access it, and that was one thing we fought for way back, was dignified access. You probably heard this term. If you're working with the people I think you are, you've probably heard that several times. And that's why legalization was easy for us to process through, because with all these dispensaries and all this recreational use, there was going to be dignified access for patients. Here is where they went wrong. They put our edibles at 10 milligrams, and that's it. If they would have kept it at milligram level, like wide open for patients to be able to access, because my question is too, what's recreational about salve and caps? But they're allowing those to be, accessed in the stores. You can buy capsules with 250 in a thing at 10 milligrams each. That's 2,500 milligrams per package. You can buy them here in town. Oh, were you down here? We've got them on the shelf.
Yeah, they were supposed to be taken off the shelf like probably 2 months ago.
Down. I'm not sure exactly what they are, but again, what's recreational about crabs? Nothing. Again, what are you going to do? Rub lotion on your hands for around a campfire at night? Like, that's not recreational, right? But again, if
you have to pay a huge money for your medicine, you've already taken out half the people who need it because they don't have any money. Right? Their system of to is what that is. Even if they raise the amount of the allowable THC in the edibles in stores, the homeless not buy it.
Well, and you know what? Most people can't afford it either, even if they're not homeless. Let's face it. I mean, the affordability price point in the stores has come down. Like, you can buy an ounce for under $100 now in the stores. Now, the quality isn't top end either, right? But here's what I was talking to Asia about this morning too, and I was talking to her. The problem that, when we were talking about what we're doing, and we're giving away cannabis to patients and people on the street for whatever reason, and we're giving it away. They're not worried about us. They're worried about how we're accessing it, and who we're accessing it from, because they know that there's a huge online present market, and that's what they want to catch. They don't care that we're giving cannabis. They don't give a flying fuck about that. They want to catch the people growing thousands of plants underground, because they know that they're still there, and they're producing under the not under the legal labels, right? And that's again back to Dan. They're not getting the money. Right? So they couldn't get everybody into the legal market. And they know that, because there's a lot of us that don't qualify for legal market. 90% of the people that are doing online business would not qualify under the legal market, and they're not going to stop what they're doing. And they're doing it and undercutting and being more affordable. But that's where we're going to run into where they think they're going to, catch us, right? So we have to, start, instead of outing, we need to start wrapping ourselves in protecting. And I said that before. Instead of, flapping all over fucking social media, we need to fucking do the hug so nobody gets arrested.
That's the goal.
It's kind of hard to do when your own brothers want to call the cops on you, though.
Exactly. That's what I mean.
Supposedly.
Exactly.
But this is the
people you're supposed to trust.
But this is the thing.
You cannot. Why throw away their livelihood? Or put their.
They don't want.
Social media is a weapon, and I.
Go ahead, Dan.
Social media is being used as a weapon. Sorry, go ahead.
No, it's okay. I was just trying not to talk.
Anyway, sorry.
It's okay. Listen, the problem I feel like is the government is trying to figure out a way to keep making money on something that, frankly, they never had business in taking. And they're doing it through legislation, sneaky ways. And it's us, but it isn't the people made happy, which is the bulk of people. They're like, okay, it's legal now. Perfect. What they don't understand is it's not regulated in the sense of you don't know what you're buying. A lot of times you can't smell it, you can't taste it, you can't return it. You can't go in there and purchase enough of any edibles to be discernibly important. Like, you're not going to get high, and even if you do, it's a trick, because your system actually isn't getting the benefits at 10, 20 milligrams anyways. So if they really wanted it to be fair, the first thing they do is they'd say anybody who is on fixed income, who has a prescription for medical marijuana, should be getting all they need, just like any other prescription. What is the dose? Boom. All you need. Do the patients pay for methadone? No.
Yeah, they do. Yeah, they do.
But
My daughter,
not,
I had to pay for my daughter's Suboxone. So yeah, they do
but
actually.
commonly, our healthcare system, once you have commonly your medication, at least most of them, are covered under our Canadian healthcare system.
No,
Cannabis isn't expensive.
that's
Well,
the
I
thing.
mean,
I disagree with that statement because I have some very expensive medication where I don't even know how any form of government can expect me to pay that much. In fact, there are some medicines where I can't afford them, so I just don't take them.
And
There's
yeah,
one where
pharmaceuticals are
my
not.
whole life would be dramatically improved for $1,800 a month, but they can't seriously expect me to pay that much for medicine.
but nobody takes medications.
No,
Nobody here ever gets
our medications are not covered by any pharmacare unless you have private
no
coverage. Insurance.
because I covered lots of them.
From who? You must be on like benefits or social because we're not. Like I'm not.
Yeah, definitely I'm not getting any help.
No.
I'm on disability. That's why.
No,
That's what
why,
this is.
right?
This is what I'm.
If you're not on any disability, if you're not on any social services, if you work like if I worked without my husband's job, my medication alone is $600 a month. That's just for my Vyvanse alone. If I didn't have
But
benefits,
I'm not talking about us. I'm not talking about us. We are the CSP. I'm talking about the people who can't get access. That's what this is about, right?
Oh, okay.
And I get what you guys are saying, but we have money, we have jobs, we'll find a way to get what we need, whatever. That's what the government thinks. But the people on the street, they know they can't. There is no system of figuring out a way to come up with the money if you really need the medication. And that's what I'm saying is it's one thing to say to people who have jobs, listen, you can go out and get privatized healthcare. It's another thing to say to people who don't even really know what they're doing through most of the day to say, yes, there is a solution here. Go ahead, apply it. Go out there and buy.
Most of those people that at least I know, my daughter's addicted on the street. She gets AISH, which is in Alberta, so she's covered by all her pharmaceuticals too. What they need to do is make cannabis
That's what
on
I'm
the
saying.
list with a DIN number so that you actually have that covered as well, right? Rather than having it just not have any out. You can have as a tax credit if you're buying it from a licensed producer as a patient, you can write it off as a tax credit, which doesn't give you money in your pocket, right? But at the end of the day, it should be covered like any other pharmaceutical medication on anybody's benefits. And if you're on disability and on living like rough or on the streets or whatever, and you're getting covered by social assistance and all your benefits are being covered, you pay $2 or whatever it is for your prescription, right? Even with my benefits through my husband's job, I'm still paying a portion of my prescriptions. I'm not getting them for $0. The distribution fee alone is $10.99 per fucking prescription because I just got them filled on Friday. And the pharmacy's charging me $10.99 per prescription for distribution. When you get 6 of them, that's 60 some odd, $65 just for them, administration fees for them. Like that on top of it's fucking ridiculous, right? Like nuts. But it should be covered, cannabis. And I think there are a couple, actually, London, there's a couple, Blue Cross, and I think there's a couple insurance companies that actually do cover cannabis if it's medical.
Right. But for the most people, and I see them every single day,
yeah,
all the time, there's no coverage. There's no help, and there's no direct. And if it would be, they offered some sort of go to clean injection, that stuff. They're not offering you the concept of using cannabis at all. It's not even the conversation.
I think the most disturbing thing I hear is that people don't like the fact that that harm reduction is a thing. They don't like the fact that people are being able to access clean needles and clean pipes, and I think that's appalling. Never mind that they're worried about what we're going to be giving out for cannabis. Like I'm wondering, do I have to write in the bag, this is how many milligrams, so if something happens, I'm not liable for it too, right? Because you always think in the back of your head, like, what if somebody greens out and ends up at the hospital and says, I got this bag
Yes, you do. Yes, you do. I write down the milligrams and all the edibles I give to my clients because if they come back to me and say something happened, I think they could say, it wasn't
right. Yeah, and that's what I was kind of like wondering. Like, should I put stuff in the bag with the amount of milligrams and stuff so that nobody
as far as the harm reduction goes, I've been listening to the rhetoric, and it's because here we go again with assumptions. Like when you're going politically going public saying that we give people drugs and safe injection sites, not the truth, actually. or that these shelters are drug dens for addicts. Not the truth. In a lot of cases, these are the vocal points where people are coming from an ostracized place to having some sort of resource and help that maybe can intervene. And you come to a safe injection site, you come with the drugs you bought off the street, and we're there to help you. We can test it for you. We can give you a clean syringe. And if you overdose, well, fancy that. We can bring you back to life.
Right.
It's,
and I think
and
that's
for them to say that the safe injection sites are the reason why the overdose epidemic has skyrocketed is, here we go with misinformation and assumptions of what they think we're doing in these places, which is not what we're doing.
Well, there's two conversations there. I mean, I love the concept of harm reduction, and I think it's stupid to try and shoot it down, because that's the same thing as saying don't. But the truth is what we're trying to do is bring comfort to people who have none. It isn't just a matter of getting them off the drugs, although I'd love to get everybody off all the drugs.
Not that easy.
Is if you go out there and you spend a day out in a field in the rain, in shoddy clothing, with no shower and no food, and somebody comes up to you and they give you a joint or a edible or some food, that can be the difference in your day of whether you decide to kill yourself or maybe go another. Somehow people think, well, that's not important. Let's instead treat these people like animals and sort of push them into these other places where they're not in our eyesight.
We've always maintained that quality of life is something, even as a medical user, we need. And the cannabis is a therapeutic quality of life, right? And giving it to people that have lived with trauma. And that's it. Like, let's face it, we're all dealing with it ourselves. Never mind the fact that we've also got that now that you're out there dealing with people with trauma on a weekly basis, right? And then Adam, you are dealing with them on a daily basis. So, I mean, dealing with these people on a one-on-one, you finally get to hear their stories. And then you take that back, and you bring that back. And then you take that back to, and that's when that's when, our activism side comes in. And that's when, like Dan says, we got to go see the mayor. And you got to go sit in that MP's office, and you got to start that campaign to write, letters to your MLAs. And right now we're in a goddamn election in British Columbia, and we should be standing in front of those, candidates, asking them the hard questions. Why are we not introducing this? Why are we not doing this? And I don't know how many of you are political on that end of things. I know I'm very political. Asia's done her, part along the way too. But we need to be standing in those MLA's offices now. Or they're not MLAs right now, but standing in front of those candidates. And stand in front of that conservative candidate and ask him, as he's breaking down healthcare and he's going to, start incarcerating people for addiction and taking, tents down, what is the aftermath of the trauma of that? Because you're already dealing with people with trauma, and then you're going to cause them more trauma, and then what are you going to end up with? And I'm not saying that there aren't some people that are, that are mental health and that are harmful to themselves and others that should not be helped. That is something that there are a very slim, small percentage of people that are on the streets that are that harmful to themselves and others. A very small portion.
So Tamara,
well, that's why I would start with cannabis, and then you move there, right? You remove the 30% or 50% or whatever you imagine it might be, people who would take that path. And trust me, because I talk every day, I'm saying I would do it if it was available. And that is 10 to 15 days straight of sitting there just getting hit with edibles, sleeping and getting through that sickness, and then moving your way past it and starting a different lifestyle, which, believe it or not, part of the allure of cannabis is the fact that it is in fact not just something to do, but a lifestyle and a family of people that expands the globe. And once you become part of it, you actually don't want to go back to that other lifestyle because you feel comfortable with your life. To get to that point, though, you have to know someone is going to be there for you and that there's going to be enough. Because if you run out, if you don't have enough supplies, they're going to get a third of the way there. They're not going to believe it's working, and they're never going to try it again.
So I'd like to point out that currently with all the provincial parties that are running, the Conservative Party, the NDP, and the Liberal Party all plan to take the same approach with drug addiction and
involuntary
expansion.
treatment.
So it doesn't matter who you vote for. That's what's going to play out.
I know. That's why we need to be starting to be, like I said, standing in front of them and telling them this is wrong. Their policy needs to change before they even get elected, because we've got 15 days to change their minds.
But I would also like to point out that when I went to the federal NDP convention in in Hamilton last year, MLA, or sort of MLAs, but some MLAs, because they were actually present, but also MPs are discussing how cannabis substitution can be used in drug rehabilitation, and it is coming to fruition. It just takes time. And I heard you, Dan, discussing about how you wanted LPs to be able to give out their weed that's gone to expiry to be used for said sources. That's something that will probably, unfortunately, never come to fruition. However, those LPs providing good, viable weed to said cannabis substitution programs would be considered what they would put in place. So I don't know how long this will take, but I believe at some point every province by a federal rule will be given permission to substitute it with that versus, say, I think it's called naloxone. There's a whole bunch of different alternatives to opiates.
We got Suboxone, we got
Suboxone, thank you.
We got Methadose, and we got Cadian.
So they would probably offer that in the list of those items that you could choose to get off of it.
They don't use them now.
Be a viable option.
There's viable options, but they told Brianna that she had to quit using cannabis at least 2 weeks before she hit Eventa, because they were not allowed to use any substances at all. And if they had to even smoke a cigarette, they had to leave the property. That's why she was
interesting that cigarettes have been allowed even if you leave the property, and drinking coffee, which is horrifically addicting, have been okayed. So we're hoping, at least I'm hoping, that will be changed.
In Alberta, when you go to detox, you cannot drink coffee and you cannot smoke cigarettes. So you're coming off an addiction of a substance. Never mind, you can have
stupid,
have nicotine,
so dumb.
Right? But they've done that in Alberta. That's why addicts are set up for failure. You go to detox.
Lived experience here. Couldn't handle after 3 days of no cigarette. I'm like, I gotta go. Can't do it. If I could have had a cigarette, I would have stayed longer. But I was nicking out more than anything.
Right?
I need a damn cigarette.
Right? And that's the problem. They cut off everything for you so that you can't even straight. So how can you even think about getting off the substance that you're getting off of? Nicotine and caffeine are hard enough, and now you want them to do it all at once at the same time. Like you're setting them up for failure, and then waiting for another 3 months after detox you can find a fucking bed to go to treatment.
That's because abstinence-based rehabilitation on its own is the least effective type of rehabilitation.
Right?
The stats are clear. 3% of people succeed with abstinence-based treatment. Only 3%.
Yes, for my daughter. And guys,
a very low number.
There you go.
Yeah, there's also not enough housing to place them in abstinence.
Which puts you actually at greater risk of overdose, because if you go back to using after some abstinence, you're at higher risk of dying because your tolerance level's gone down.
Right. Okay, I gotta take my break. We're 3 minutes behind on the break, and I gotta thank my sponsors, or we're gonna be in trouble. So we're right back after a quick break. Thanks to my sponsors, and we'll be just 2 minutes, and that's it. So we'll be right back.
You're listening to the Pace Radio Network here at paceradio.net.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
Are you looking to get your medical cannabis grow license? Limestone City Hydroponics can help patients through the process of obtaining their license to grow medical cannabis. What's that? You don't have a doctor. If you meet the medical criteria, Limestone City Hydroponics has a nurse practitioner who can assess and provide medical cannabis prescriptions. What are you waiting for? Contact Limestone City Hydroponics at limestonecityhydroponics.ca or call them at 613-548-0420.
What do you find at paceradio.net? People advocating cannabis education.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more. We've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop. 17 Bridge Street West, Campbellford.
Are you looking for non-stop, continuous cannabis and psychedelic programming? If you are, then turn your browsers to 420radio.ca or paceradio.net, where you will find the 420 Pace re-rolled Saturday. Everything gets started at 8 a.m. Eastern Saturday morning.
Cannabis edibles are an effective way to manage pain and other ailments, especially when you deal with your trusted partner, Legacy 420, in Tyendinaga Mohawk territory. You see, we lab test every product on site to ensure proper dosage every time, which is critical when consuming cannabis edibles. All Legacy 420 edibles are made by our classically trained baker and chocolatier, and we also have super tasty vegan options.
Our baker has been in the industry for 25 years. She's also a chocolatier. Everything from savory to sweet, your chocolate bars, brownies, butter tarts, you name it, we make it.
Talk to our knowledgeable Cannatex about our incredible variety available. Give your trusted partners a call. Legacy 420 out on your road.
You're listening to the Pace Radio Network here at paceradio.net.
All right, we are back. Oh, that one up. There we are. Oh, great. So yeah, Legacy 420 actually delivers our. God, this back is terrible. I've got this wacky back, whatever going on.
I think if all of us that aren't talking turn our mics on mute, it should help with that.
Usually it does, but there we go. Anyways, so we're back with all my guests. We got Rosie from CSP Surrey with us. We got Adam from the VS or CPS from Vancouver prior to. We got Asia with 3 Happy Cats, 12 White Chicks, and everybody knows Asia. And Dan with CSP Langley. And me, of course. I'm always here. But so we're back to doing like the fact of the matter, like we were talking about dignified access to for patients, right? And the fact that we're doing this for as a free service to people, and it doesn't have to be people that are homeless either, right? Like if you set up and you're down there, you're not, it's a no questions asked thing, right?
Yeah, I mean, I'll pretty much, if you look like you need it, I'll give it to you. But from my perspective, I do try really hard to know the people, because, you know, just giving out cannabis isn't a solution to anything. Finding the people from it, finding out the ones who really want to change their patterns and applying that particular, it's just like any other medicine. If you give the right dose for the right reason, you're going to get the right results. I have right this minute several people that I go to every day, and I give them large amounts of THC and cannabis edibles, and they are sleeping. 6 people so far who's gone through the program, myself personally, the Langley one, who have quit and now work with me, right? This process works. And this is the part that's frustrating, is if you're going to apply all of the multi-million-dollar solutions to a problem we all share, the government shares this problem with us. So we're going to apply all these multi-millions of, citizen dollars to this problem. Then why not do it intelligently and remove with the cheap version, which cannabis doesn't cost that much to make as a medicine, as far as some things are concerned.
It costs a lot more now that the government's got its hands on it.
Is solve this problem with not really all that much money, and what you would have is a removal of, I don't know, we can estimate the amount of people. I would argue it's 40% or higher that would take this process and walk and get away from it. And then what you have left are the severely addicted and the mentally disabled.
That do need to go into involuntary treatment and do a psych evaluation and get trauma-informed care and get all that help that they need and deserve and get stabilized on the proper medications instead of medicating with crystal meth, because they've been left under the radar and have fallen through the gaps for so long that they're so far gone trying to get him out of this lifestyle is like next to impossible, and the drugs people are using today are physically changing their brains, man. It's frying their brains. They're using xylazine. They're using stuff that's not meant for human consumption. This is not even a game or a joke anymore. People's lives are at stake. That's the bottom line. And the opposite of addiction is connection. Like you said, Dan, there is so much more to the CSP every week than just going and giving people a doobie and a cookie. I sit there. I have these valuable conversations. Here's a really great story. A guy was staying in the shelter in the parking lot where I give out cannabis, and he was staying there for a whole week using. I gave him a whole goodie bag of cannabis cookie stuff because he's like, this helps me not want to use. He's like, I'm waiting to go to treatment. I gave him that bag. It got him through. He came and saw me last week after 4 months clean to say thank you. Oh my God, I made it to treatment. And I'm telling you, like, I ate that cookie and went to sleep, and it really helped me get over that edge. And I didn't want to use that day. I didn't want to use for that minute, even if it's for that minute or that hour. Hey, I've saved the day. I've saved a life. You guys don't understand, like, how much this particular subject impacts my life. My own mother overdosed, okay, and died in 2008. Okay.
Actually,
so it hits hard for me, right?
Everybody has family that this is affected, whether it's somebody out there or somebody who's lost somebody out there. Okay, so everybody, this problem touches us all.
Yeah.
And when what happens is when you sit out there, you see tents and you see a bunch of zombies walking around.
It's terrible.
Sensitize themselves to these being people, but a great deal of people started off with just a minor injury where they went to the doctor because let's remember. The homeless and the heavily addicted didn't invent opiates, okay?
No.
The doctors,
Big Pharma did.
So now you go to the doctor, you have a knee injury, you get some opiates for it. Before you know it, they think you've had enough. Your injury's good now, as far as they're concerned, and they cut you off. And then they say, now you're an addict because you keep trying to come back for more opiates because you say your knee still hurts. So what choices does that leave these people? Now they're on the street.
Who's got the pills? Where? Hey, who's got some dillies? Where are you? Carnegie Corner. It's true, Asia. You know it. T3s. Just go to Carnegie Corner. You get a pill on any kind of pill.
Really? And like you can't do that here. Like it's I don't know. Like maybe it's like that here too. Oh,
there's
Jesus.
like 4 places in the Lower Mainland that like anything you can think of, if you have money or stuff, you can get it. It's insane.
You can buy pills right off the corner of Carnegie Corner. You got dillies, morphine, whatever you want. You want T3s? You want
oxycodone? That's the thing. Are they safe? They're not safe.
No, absolutely not.
They're people's prescriptions, though. I think, or maybe
a lot of the time still with their name on it.
They're not.
You're
in
right.
some cases, they are pressed pills that are replicated. And there was a case where they were fentanyl and I think chalk, and they got busted for it. But
but you know, back when I was on Hastings, it wasn't like that. We knew if I went to the corner, I knew I was buying a dilly 8. Nowadays, you don't know what you're buying. It's a lot scarier and a lot rougher than it's ever been, and I admit that. You know, I got off the downtown east side 15 years ago. Okay, so I used to be homeless on the streets, so I know
absolutely.
Right? I know.
My daughter's actually using. I watched it. Like she's using meth and whatever she can get her hands on, and I had her on FaceTime last week, and just the behavior is just unbelievable. Now, what's your thoughts on this new doctor that they've got in top of addiction? Like they're saying that every time you OD, you have brain damage, right? What's your thoughts on that?
Yeah, well, you're losing oxygen to your brain. So it takes up to 3 minutes, right, for your brain to start to deplete oxygen and brain cells die. 5 minutes, you should be brain dead. I've seen people go out longer, and I don't know, by the grace of God, but yes, you know, when you're cutting off oxygen to vital brain cells, you're creating damage. And I don't think it's just that with the overdose. That's the drugs people are using today. It's changing people. They are different people.
Well,
they're putting things like tranquilizer in it.
Yes, like the drugs I was
like
not the drugs they have on the streets today. Like what the fuck was that? I was watching, like, seriously, like the behavior I saw my daughter, it was just like, it was like watching Mardi Gras. It was like, what the fuck was that? Like, what is she doing? Like, it was just like.
Yeah, I've seen it on the downtown east side every day. You have no idea what these people are doing, and half the time they don't know what they're doing.
I know.
Especially when the trank dope came out. like they would take a hit and then they wouldn't see the rest of the day.
Oh my god.
They'd be functional and doing things, but they wouldn't see it until they'd finally come back to life, like literally, 20 hours later.
Yeah, like it's just heartbreaking. Like, I mean, I see it here. Like, I'm in a population of 20,000, and you drive down, and people don't want to go to Dairy Queen or McDonald's and take their kids anymore because they're seeing people like it's bad, right?
The small towns get it really bad. I come from a small town in Northern Ontario, and I actually heard about fent there on a trip back to see my parents before I heard about it here in Vancouver. They were breaking into pharmacies to steal the patches, used patches at that.
Wow.
Yeah, it was really crazy. And then I went back I think it was 2 years later, and I'd never seen the city like that before. Like, it's always been a drug-filled little city, but I mean, when I left 15 years ago, if you wanted to smoke a rock, you'd have to cook it yourself. And then I went back like a year and a half to. Yeah, and I went back a year and a half, 2 years later, and then all of a sudden it was like everything was there. It was crazy, and I was fairly in tune with the drug scene back then when I was
being shut down the way they are. You have to know how they're getting it into the country, right? They're mailing it in apparently. Like, I mean, it's getting in. Like, no matter how you look at it, it's getting in. No matter how we lock down the doors, how much they do.
But a lot of it's being made.
Drugs, right?
A lot of it's getting made here, though.
That's what I. Yeah, exactly. Like, it's being made here, right? So it's not real. How can you make real cocaine out of what? What are you making out of?
Right. Well, and that's the thing, though, is it's so scary.
Cocaine, guys. There is actually the very first federally approved cocaine manufacturing company down the road for me. I realize they have ceased production. I think they produced a gram or something, but it is legitimately down there, and they were experimenting with that over COVID. And I'm not really sure why they stopped, but
I think they made 70.
There, it is a thing.
They were given the okay to make 70 grams, I believe. But I mean, in the grand scheme of things, that's still so minuscule. I'm not sure.
This is
interesting.
I should have read more, but I didn't get into it too far. But I was like, "There's a what down the street?"
I clicked.
Oh, we just lost
Adam's gone.
That's how they should roll out the program. The reason why the opioids are ending up on the street is because you can't give a crackhead opioids and as a safe supply and expect them. That's not their drug of choice, right? They want cocaine. They don't want fucking.
But I honestly think that they did that because they're gearing up to want to be the dealers of those drugs.
They should be.
Well, from a medical perspective, if you go into the hospital and you tell them I took half a gram of cocaine that I got from pharmacy number 77, they know that's what you took. But if you go to
they can test the batch.
They have no fucking clue what's actually in your system.
I'm right on board for that. I think they should be manufacturing it all and fucking end. As much as they don't want the government's hands in it, but then it's safe and it's tested and people aren't going to fucking die from it.
Well,
that's the thing. That's the thing too. Is that that I tell people all the time. I said, it's as easy as people not cleaning their scales. A couple of grains of salt is enough to kill people.
I know.
And that's a dangerous thing. Like I've got a 16-year-old daughter, and she, I'm sure she's gonna sample in some things down the road. But I tried to tell her, stay with a dealer that sells one thing.
Yeah.
You know what I mean? That way, there's no contamination.
Scary topic.
Because people are late. Yeah, it is. It's terrifying.
My boys are turning 9 in 10 days, boy. They're last year single digits.
Well, even my son back in Ontario, like at the skate park, they were offering him down when he was like 12.
Yeah,
they're getting.
Yeah. Don't say that.
I almost jumped on a plane.
I swear to God, I'm gonna be that mama. You're gonna see me on TikTok. Look at this crazy ass woman at the school going nuts on the kid. You're gonna.
Oh, I almost got on a plane.
Fucking asshole kid. Where's your parents? Go get your damn parents.
But it was a small enough place that I could.
Slap your mom
I probably
right
knew
now.
their parents. You know,
Oh
I
my
probably knew
God.
their parents. Yeah, it was crazy. I almost got on a plane right then and there.
That's, I'm telling you, I'm so fearful of this because the kids are up against a whole new world, not the world I had, social media and the weapon of social media and using. They have such a world they have to live up to, you know, because it's right there in front of them every single day. And I
And
worry
everybody's
for
watching. Everybody's watching. Yeah, it's terrifying because it feels like it probably feels like they're under a microscope.
Can I say something here?
Sorry to say this.
I'm trying to interject.
You know why I mostly fear for my kids? Because I'm white and they're white.
Yeah.
That's right.
100%.
I said it.
Okay.
It's true. My kids are the minority at their school. They're the only Caucasian kids in their class.
Never mind.
And the other kids don't speak English. So and then the teachers get mad at me because my kids have no friends. Well, I don't know what to tell you. Maybe they should speak English. Sorry, I said it.
Okay. I think if we can bring it back just for a second to one important fact.
Dad.
Of other drugs and what they're originally purposed for. They've been doing it with drugs forever. All of the drugs on the market are synthesized plants. That's what they do. And that's what they want to do with cannabis. The problem is they want us all to buy their version of cannabis. And down the road, that's going to become a much bigger problem than they realize. It's a double-sided problem, though. People on the ground. What's happening? What is?
We're listening, Dad.
Am I yelling?
No, but again, the thing is with the cannabis too, like we have the microcrafting. Thankfully, we do have the microcrafting, market. It's not following all the rules.
Problem is, though, there is two sides of this argument, and a lot of them are street dealing drug dealers who want fentanyl and are fighting against us underneath the guise of what it is we. I see these guys all the time dressed as homeless people, sitting around with a bunch of other homeless people, waiting till we're gone and selling. Like there's a huge dynamic here, and what happened was a long time ago, the fentanyl dealers realized if we slip, like Adam said, one crystal, we can get them all on our side of the fence. That's why cocaine isn't around as much. That's why there's designer drugs, because everybody wants you on the same drug because it's cheap, easy to, and you're addicted.
That's a theory that I've never thought of actually. Because like it's gone just everybody's doing fentanyl. Like why is everybody drug of choice fentanyl? Like who wants to do fentanyl? Like also doing fentanyl. Like what the fuck?
It's
I
deliberate.
don't want to sound silly and interrupt, but I was given medical grade fentanyl during a medical procedure. If you've ever had fentanyl, wow, I can see why there's a draw to it. Like I could have had a crocodile gnawing off my leg, and I would have been like, "Ooh, yeah, this is great." It was.
I gave it to my 15-year-old when he dislocated his elbow, and I'm scared.
I had my son Key, and they gave me some form of fentanyl through like a drip, and I pushed the button a couple times, and finally the doctor's like, "Would you like to hold your baby?" And I was like, "There's a baby?" So that's how powerful that drug is. And when they offered it to me the next time for my son Fox, they said, "No, I forgot there was a baby last time with that stuff. I'm good.
I'm good on the morphine. Thanks. No fentanyl for me." Yeah, like it's like I said, like that's all I hear is people are doing fentanyl, and we had a 13-year-old kid here die of an overdose from fentanyl.
Yeah, that's terrible. We had one on the downtown east side that was 12 not too long ago, and that one those ones hit hard,
Right, but we can't. Like I said to one of the guys that's going to come out and help me. I said, we're not doing this for you. You're involved in the youth project. This is not for 19 and under. I cannot risk giving children, as much as I think it's a good thing. Like I don't like it's not my rules. I just have to follow, right? Because edibles maybe for 15-year-olds, so even sleep instead of smoking crack or meth would be a good thing, right? Because that's what's going on in our town. There's a lot of youth that are doing that hard, and like I said this before, like we've regulated cannabis so much that children don't have access anymore. Now they're trying harder drugs. So how are we protecting the children?
And a lot of the time, those other drugs are more available.
That's what I mean.
The sad part. That's the sad
Where
part.
everybody was just smoking weed. The kids were just, taking their bongs around. They were sitting around the skate park with their bongs. Now they can't access any cannabis because it's all 19 and over regulated. Now they're smoking meth in their bongs. So how is that protecting the children?
Yeah, it's doing completely the opposite.
Right.
Especially, I've seen it all the time. You see them, 15, 16-year-old kids down on the east side, and they're just looking for weed. It's really, really hard not to give it to them.
Right.
Because literally the next block, they got a dealer for every drug.
Hey, you know what the solution to this would be? Have their doctors prescribe it to them, because you can prescribe, as a doctor, you can prescribe somebody underage the use of
Try and find a doctor.
That's not a bad idea.
The thing is, doctors will not prescribe under the age of 18 either. And we found that with kids that absolutely
my
need it.
nephew had prescribed to him at 15 for his bone disease.
Well, depending, but like I said, we had a hell of a time. Even Mandy McKnight had a fuck of a time getting me. Even Sarah, even Haley.
That's what I'm saying. Why is there a hard time getting that?
I don't know. Because the doctors won't even sign for us, because the College of Physicians actively will not sign for us, because cannabis is not recognized as medicine by Health Canada.
Right. That's because the official position about cannabis is that it is dangerous. And if the reason for that is because as long as it's dangerous, we won't treat it as it really should, which is a relatively mild thing in the world of.
And I stood up in 2014 and said, unless you guys recognize this as medicine, we're always going to have the same commander. And that was in a legalization roundtable in Vancouver. And I was there, and Esau was there, and we all said the same thing. Until you absolutely see cannabis as a medicine, and actually state cannabis as a medicine, we're going to keep going around and around and around in circles and back and forth and back and forth and back and forth. And they still don't care.
The federal government and the province of BC allows for Nabalone and Sesame, which is, two different brands of synthetic THC, but no actual THC. So it's recognized, but not the way I would want it to be, if that makes sense.
Giving real THC, real weed to somebody implies that it's a medicine. I can't take that risk because it risks their profit line. Ibuprofen, sleep aids, anti-nausea medication, and all the other things that cannabis do, that they make money off of right now. So they can't. That's why we don't have stores for bleach. Is a dangerous thing, and your kids go under and drink it. But why don't we have a special store? How come it's 300 meters away from the school? It's way more dangerous than cannabis. But we allow our parents to take care of those children and make sure they don't drink bleach. But we don't give them that same respect when it comes to a plant we grow in the backyard. Because of course, your 6-year-old might go outside and eat a plant. It's preposterous.
That's the most ridiculous shit ever, I know.
It's just about money. And the fact that they have managed to sell this lie that cannabis is dangerous to the general populace is quite amazing to me, because every single day I run into people who treat it as if it's dangerous. I've had people come, officials, and I've actually, after sitting down talking for 20 minutes, they have no choice but to go, oh yeah, that makes sense.
Yeah.
At point 7 till you eat them, and you're allowed to throw them around everywhere.
Okay, guys, we got to wrap it up. We've got 2 minutes left. So shout outs or anything anybody wants to have to say besides,
A shout out to Asia, May, Moon, Adam, I don't know how to say your name, and Rosie, and of course you, Tamara, for taking on this fight. You guys are all badass warriors, and I love all of you.
The feeling is mutual, my friend.
John, I can't say your last name either.
And so for
no, you know what? I love when telemarketers call me.
Evil, see no evil.
I'd love not hit it, please. Please keep the wraps.
And five days left. 5 days left.
5 days.
5 days.
And actually, I can't wait.
Halloween and the 420 Live end of the month, Asia May, is actually holding that.
Right.
Captain is going to be a sponsor. Please get a hold of my friend here, because she can always use the extra hand.
That's true. I was going to say, if we're going to do some shout outs, I would like to shout out to Heisenherb for being our gold sponsor, and Bovida for being our platinum sponsor. I'd also like to thank Medman Mad Hatter. I'd like to thank the CSP Langley. I realize that they're just offering me their time, but time is super precious these days, guys. And as well as Knock Network, Pace Radio, and everybody else that's also been in the background putting all the kits together. So if anyone doesn't know how it works this year, the 42 Live is completely free to do. The first 30 people in the door get your free kit. It's extracts only. And you have from 4:20 to 7:10 to do your judging. And the remaining 12 judges are elected. So those of you that have been elected, we'll see you there when it's time. And yeah, we go all the way to midnight.
Awesome. And again, too, shout out to all you guys for all the hard work and thanks for being an inspiration to me. We launch next Saturday, which is Thanksgiving long weekend, so we're also for 10 meals. If somebody would like to donate 10 turkey dinners in the local area, that would be great. We can go to meal. If not, we'll figure something out. Relax and go out some time to, go have a shower.
Oh, and let's not forget the Hi Guys.
Woo! Right on, guys. So thanks again for all of you coming on. And like I said, we're just going to keep on doing what we do, moving forward positively. And that's the end of it. Oh, and thanks to Canadian Lumber.
Yeah.
Because they helped us all with papers. And I emailed this morning saying thank you. I got their send me a piece of papers too. It's actually because they were a sponsor of Harvest Fest. So this is a Harvest Fest from Halifax. And Canadian Lumber sponsors them. So
and don't give in to the trolls.
No.
Goodbye, trolls.
Canadian Lumber.
Yeah, Canadian Lumber. And again, to my sponsors, which are Legacy 420, Campbellford Lifestyle. Jesus, I forgot. Hydroponics. I always, and then we also have Mushy Moments too, another show that's on the network. So catch us on Wednesday, Pace Radio. On Wednesday night. So thanks guys again, and stick around after to wrap this up, and that's a wrap. Have a good day, everyone.
Later.
Now I gotta find the ending.
You're listening to the Pace Radio Network here at paceradio.net.
The opinions of the individuals during this broadcast are their own, and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
When you have a pain that's reached its peak, Legacy for 20 is so unique. If organic cannabis is what you seek, here's your trusted partner 7 days a week. Suppository salves, vapes and drops, topicals, edibles, infused pop. Just when life seems like it ain't easy, at Legacy 420 enjoy a pop freezy. Lab tested products make them the GOAT. Legacy 420 out on your road. Legacy 420 in Tyndonega Mohawk territory. Indigenous organic cannabis at its finest.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
We are people advocating cannabis education here at paceradio.net.
All right.
Well, that was
Two people. That's
I
funny.
appreciate you having us.
No, thanks for coming on, you guys. I think that was way better than sitting there doing a Michelle fucking fashion contest.
Well, she wanted to talk to her. She would have done it. She didn't want to. Bullshit.
Well, like I said, she wanted facts, and the facts are with her. And
I never wanted to argue with anybody. I frankly just, she started a fight, so I started fighting back. If you want to have an argument, I'm with you. And if not, then let's get some stuff done.
I was like, debate me.
Yeah, I did the same
So many
thing. I said,
times.
if you want to have
So
a
many
debate,
times.
she avoided
let me-
having a real conversation at all costs.
With any of us.
Yeah.
Yeah. And I
Because
that's how
she knew. She knew.
Well, I mean, people start throwing shit up that's 10 years old. You guys haven't
Right.
even been in business for 6 years. So you are donating to whoever for whatever. Oh shit.